of people heard about ALS is when they did the Ice Bucket Challenge today. Dr. Guillermo Solorzano from the UVA Neuroscience Center is here to talk about this deadly disease, and a lot of people know it as Lou Gehrig's disease, right? Because of the famous baseball player who developed it. So, since we all know it is that, what does ALS stand for?
ALS stands for amyotrophic lateral sclerosis.
And, you know, how do you screen for it? Can you screen for ALS?
Usually, typically not. It has to be a clinical suspicion. Mainly, the physician that's seeing a patient has to think about it and then typically refers it to a specialty center.
How difficult is that to diagnose? Because I think some people think maybe they had a stroke or a minor stroke or something like that because maybe their speech is slurred or something along those lines, correct?
That is correct. And usually it starts off with weakness without any kind of numbness. And so it's progressive weakness, sometimes speech difficulties, difficulty swallowing, or getting the voice out. So
I would think it's pretty rare, is it?
It's a very rare disease, and so typically that's part of the challenge of trying to diagnose it, is people not understanding it or physicians not being able to identify it right off the bat.
And I know that the Ice Bucket Challenge really brought a lot of attention to a disease that really wasn't getting a lot of attention or a lot of funding, is that correct?
Yes.
So tell me a little bit about treatments for ALS. There's no known cure, correct?
That is right. And so right now most of the treatments are geared to try to slow the disease down a little bit. And a lot of research has been done at trying to find actual treatments that lengthen life or hopefully cure it at some point in time.
Tell me about what you're doing at UVA to bring about treatments and maybe hopefully one day a cure, obviously.
So at UVA we have a multidisciplinary clinic, and actually it was the first one in the state. There's 5 clinics that specialize in ALS and have specialists that are neuromuscular disease trained and other staff as well. And so a lot of the times we give the subspecialty care to our patients. We also participate in clinical trials that are not just local but more up and down the East Coast.
So a lot of people are taking part in these trials right now as far as some of the medication that's being developed at UVA?
Currently there's no treatment trials at UVA right now, but most of the time we ask our patients whether they want to participate and try to get a better understanding of this disease and hopefully come up with a cure at some point.
Let's hope so, right?
That's right.
All right. Doctor, thank you so much for coming out today.
Thank you very much.
We really
Thank
do
you for having me.
appreciate certainly a disease we definitely want to get the awareness out about.
That's right.